So hi friends. So hi friends. We will be discussing examination of swellings. I'm Dr. Abhin Meglani, Department of Oral and Maxillofacial Surgery. So we'll be discussing how to examine swellings basically of the head and neck region, the area relative to the oral and maxillofacial region only. So, what is a swelling? Any enlargement or protuberance in the body due to any cause. So, this cause can be of four different types. And accordingly, we can be dividing a swelling into four different types. That is a trauma, injury, inflammatory conditions, pathological conditions like cyst, abscess, or tumor. So, what is a cyst? A cyst is a swelling containing pus, fluid, lymph, or blood or gas. True cyst or false cyst are the two types of any cyst. So a cyst lined with epithelium can be there. For example, like dentigerous cyst, radicular cyst, and a false cyst can is the one which doesn't is not lined by any epithelium, like aneurysmal bone cyst. Then the steps in diagnosis of a swelling sequentially we will be discussing. First of all, we have to take the complete history, then the clinical examination, then the radiographic examination, and then finally we will get to a diagnosis. So the history taking. So first of all, we will be asking the patient कि कब से है आपको swelling, the duration of swelling we have to ask, then the mode of onset कि कैसे हुआ swelling, कब से है, associated symptoms कि for example if he has a thyroid swelling, so we will be asking कि निगलने में सांस लेने में कुछ कठिनाई है या दर्द है. So progression of swelling, आकार में कोई परिवर्तन है या फिर कुछ साइज आपका बढ़ रहा है स्वेलिंग का. इंस्पेक्ट फॉर एग्जैक्ट साइट, चेक फॉर फीवर एंड रिकरेंस ऑफ swelling. So the duration of action, duration of swelling. So how long is the swelling present there? So a congenital swelling can be like bronchial cyst, dermoid cyst, or a meningocele. So swelling with a short duration with pain is usually a symptom of an inflammatory swelling. A swelling of short duration without pain is usually neoplastic. Swelling with long duration with pain is a chronic inflammatory swelling. The swelling of long duration without pain can be a benign neoplasm. So, the mode of onset, how did the swelling start? Developed after a trauma, like post extraction swelling, a hematoma, developed suddenly and grow rapidly with severe pain, inflammatory swelling, noticed casually and gradually increased in size, neoplasm, may occur from pre existing conditions. So, associated symptoms, difficulty in breathing, for example, cellulitis involving trachea, difficulty in swallowing, example, goiter, angioedema. So, nature, throbbing in nature, stabbing, lancinating in nature. The pain is sudden, sharp, severe with short duration. Site, sometimes the pain is referred to some other site than the affected one. For example, the pain of impacted third molar, leading to pain in temporal region. So, the pain is most commonly seen in traumatic or inflammatory swellings, may be absent in neoplastic swellings. Progression of swelling. Is there any change in the size since the swelling was first noticed? So, benign swelling grows very slowly, remains static for a long time. The malignant swelling grows very rapidly. A malignant transformation of benign growths suddenly increases in size after remaining static for a long time. So we will then inspect the exact site. For example, a small swelling, easy to inspect the exact site. And if there is a large swelling, exact site of the swelling can be asked by the patient by asking him from where the swelling started to grow or originated from its first notice. So then we will be checking for the fever. So a fever signals a broader immune response and often indicates the body is fighting a bacterial, viral, or any other pathogenic infection. So a swelling with no fever, usually benign, suggests a localized inflammation due to a non-infectious cause such as a sprain, a minor cyst, or simply an allergic reaction. Then we come to swelling, which has a fever along with the systemic fever, potentially serious. So the points toward a potentially infection that requires medical intervention, such as cellulitis, abscess, infected cyst or wound, infected lymph nodes. Now we will be asking that whether the swelling had a recurrence. So recurrence even after removing the cause indicates malignant change in benign growth. For example, an odontogenic keratocyst, the cysts, if are not properly enucleated, may lead to a recurrence because of the presence of daughter cells, as in the case of odontogenic keratocyst. So a local examination, we will be inspecting first of all, then palpating, then percussing, and then auscultating. Inspection includes sight, color, shape, size, edge, number, impulse on cuff, movement on deglutition. On palpation, we will be checking temperature, tenderness, pulsations, shape and extent, surface, edge or margin, consistency, fluctuation, transillumination, reducibility, compressibility, fixity to the skin, regional lymph nodes. The percussion wave is used mostly for the abdominal swellings, and auscultation. Vascular sounds may be detected. For example, a bruit may be heard over a large tumor, vascular goiter, or arterial aneurysms. The local examination, we will be doing inspection first of all. We will be checking for the exact site. Few swellings are peculiar in their positions. For example, dermoid cyst seen at the midline of the body. A local examination, we will next be checking the color. For example, a black as well. Black is usually a benign nevus or melanoma, as you can see here. A red or purple, there is an hemangioma as the small child. And a blue appearance maybe of the ranula, which mostly appears on the floor of the mouth beneath the tongue. And the other red and edematous swellings are majorly inflammatory swellings. A tense glossy with venous prominence, sarcoma with a rapid growth, or a presence of black color, sebaceous cyst. Sometimes the skin over the growth look like an orange peel due to edematous swelling from blockage of small lymphatics in skin. So visible pulsation seen in AV malformations or hemangiomas. Local examination. On the third point, we will be checking the shape. Is it ovoid, pear, spherical, irregular? Then size, horizontal and vertical dimensions are noticed in centimeters. Edge, which is clearly distinct from the surrounding tissue. For example, pedunculated growth like pulp polyp. On local examination, then the next step, we will be checking for the number, that is single, solitary, that is cyst or lipoma, multiple like tubercular lymphadenitis, neurofibromatosis, as you can see in these images. Then impulse on cuff. So the swellings which are continuous with the cranial cavity or the spinal cavity, abdominal cavity, pleural cavity will give impulse on cuff. To ask the patient to cuff and inspect the swelling. If a visible increase in size of the swelling, it means our test came out to be positive. Then we'll be seeing the movement on deglutition. The swellings fixed to larynx or trachea moves on deglutition. For example, thyroid swellings, a thyroglossal duct cyst. So why thyroid swellings move up with deglutition? So the thyroid is enclosed in a pretracheal fascia, attaches to thyroid and cricoid cartilages via Berry's ligaments and superior constrictor muscle contraction during deglutition. These cartilages move up along with these thyroid moves up. So on palpation, we will be checking the temperature. Local temperature will be raised due to an increased vascularity of swellings due to infection or well vascularized tumor, sarcoma. And temperature can be examined by back of fingers over the swelling. The tenderness, pain on exerting pressure over the swelling. Inflammatory swellings are always tender. Neoplastic swellings may or may not be tender. Then coming to the pulsations, you first of all notice the both of the figures A and B. If the fingers move, the arrows depict the fingers which are placed on the swelling. If the fingers are moving away from the swelling, it's the figure A, and in the figure B, both the fingers move in the same direction. So the swellings arising from the arteries are pulsatile, for example, aneurysms. So the pulsations due to presence of swelling just superficial to the artery, termed as transmitted pulsations, it can be examined by placing fingers over the swelling. In case the fingers move outwards, it is termed as a transmitted pulsation. And the pulsations of swellings arising from arterial walls are expansile pulsations. It can be examined as similar to the above mentioned, but if your fingers move upwards, it can be confirmed as expansile, for example, an aneurysm. Then size, shape, and extent, as discussed earlier, we will be checking out the vertical and horizontal dimensions by, which are confirmed by palpation only, and surface of the swelling. So we have to. So the surface can be a smooth, lobular with smooth bumps, lipoma, and nodular lymph nodes, and irregular and rough carcinoma. So the first of all, the surface will always be checked on inspection and confirmed on palpation. So now we will be coming on the edge or margin. So a neoplastic or chronic inflammatory swellings have a well-defined margins, and the benign have smooth margins, malignant ones have irregular margins, and acute inflammatory have ill-defined margins. So the procedure is by the tips of the fingers. If this, so we can check for the slip sign. Slip sign helps us to differentiate between a lipoma and a cystic swelling. Both have well-defined regular borders. When edge of the swelling is palpated with the finger, if it slips under the finger, then it's a lipoma. If it yields to finger, it is a cyst. Consistency soft. For example, lipoma, cysts, and chronic abscesses form fibroma. Hard but healing chondroma. Bony hard osteoma. So, how to access the consistency? Soft, we will be checking the ear lobule, eye of the nose, form, tip of the nose, tip of the nose, and uncontracted muscle. Hard, bridge of nose and contracted muscle. Sign of molding or indentation, soft and cystic swellings. So press a finger into swelling for 1 to 2 minutes and release it. If swelling remains indented, it indicates the presence of pultaceous material like putty-like. For example, a sebaceous cyst or dermoid cyst. Now we'll be checking fluctuation. Fluctuation is positive if the swelling has liquid or gas. So the procedure is that by one finger of each hand, sudden pressure is applied on one border of the swelling. Pressure within the swelling increases, transmits pressure to the right angles. Another finger is placed on the other border. Finger raises slowly by itself due to increased pressure, and then it comes out to be a fluctuation positive. So fluctuation can be of two types, pseudo fluctuation and cross fluctuation. Pseudo fluctuation, a false sense of fluctuation felt in large soft swellings containing no fluid, fails to expand in other parts of swelling like a true fluctuant swelling, for example, lipoma, fibroma, vascular sarcoma. And cross fluctuation, fluctuation between two separate cystic swellings communicating with each other, for example, plunging ranula and mucocele. Transillumination. The transmission of light through a swelling. It is positive if swelling containing clear fluid and thin transparent walls. It is negative if wall is thick or turbid fluid is present. For example, blood, pus, or lymph. And it has to be done in a dark room with transilluminoscope. So it is a positive in cystic hygroma, ranula, sometimes negative in hemangioma, lipoma, and solid tumors. Reducibility. Swelling is compressed from all the sides uniformly. The reducible swellings decrease in size or completely disappear. Compressibility. When pressure is applied to a swelling, it decreases in size. When pressure is released, swelling regains its size itself without any external factors like cuffing. It's commonly seen in vascular hemangioma. Fixated to the skin. Skin is pinched over different areas of swelling, non pinchable, fixed to skin, pinchable, not fixed to the skin. Then comes the regional lymph node examination. If involved, next higher group is examined. Also to examine if the swelling itself is a lymph node. So a firm and rubbery dictates that it's a lymphoma. Soft dictates is an infection. Firm and shorty, like in syphilis and viral. Matted lymph nodes in tuberculosis and sarcoidosis. Rock hard in metastatic tumors, metastatic swellings. So investigations of swelling, these all will be required in the investigation process of swellings like the X-rays, biopsy, FNAC, and CBC, ultrasonography, MRI, CT scan, 3D CT, and PET scan. Ultrasonography helps to know whether the swelling is a solid or cystic swelling. So there was an article published which had a title of Evaluation of Oral and Maxillofacial Swellings Using Ultrasonographic Features. So ultrasonography is a simple, non-invasive, inexpensive method which helps to evaluate the swellings in the oral and maxillofacial regions and had an high accuracy rate of 89% when compared to the other methods of investigations, and it helps differentiating between the inflammatory, cystic, benign, and malignant lesions based on their internal echo patterns and vascularity. Hence, ultrasound with Doppler is a reliable first-line imaging tool for diagnosing and classifying maxillofacial swellings accurately. Biopsy, an examination of tissue removed from a living body to diagnose the presence of cause or extent of disease. For example, needle biopsy, drill biopsy, brush biopsy, punch biopsy, open biopsy, like incisional biopsy or excisional biopsy. FNAC. So the procedure of FNAC includes that that 22 or 23 gauge needle and with syringe is used, and the syringe with the needle placed into the lesion and aspirated. Contents are aspirated and taken into a slide, which are then dried and fixed with absolute alcohol, stained and examined under the microscope. So, what is the Bethesda system and how does it dictate your management of thyroid swelling? It is the reporting system for thyroid cytopathology. So the Bethesda 1 is a non-diagnostic, so we have to repeat the FNAC. Bethesda 2, which is the benign, which needs a follow-up. Bethesda 3 or 4, which is the atypia or the follicular neoplasm, which helps in diagnosing a molecular testing or diagnostic lobectomy. And Bethesda 5 and 6, and which are suspicious or malignant, so it dictates that a surgery with a total thyroidectomy is required in the lesion. So complete blood count. So the inflammatory count in inflammatory swellings, we will be seeing that total count increases, and in malignant and inflammatory swellings, ESR increases and HB decreases. In recurrent abscess, there is a finding that a patient is usually has a high blood sugar levels. So computed tomography, it is advised to know the size, shape and local spread of the hard tissues lesion mainly. So MRI mainly for soft tissue swellings. Angiography for swellings with blood vessel like origin, like aneurysmal swellings, differentiates a cyst from a tumor. If in malignant tumors, angiography exhibits contrast pool inside the tumor. For example, abnormal deposition of small arteries in and around the tumors. So differential diagnosis. Here is a list we can note down that the midline swellings of the neck, jaw swellings, lateral swellings of the neck, salivary gland swellings. So coming to the thyroid swellings, the most common age that these occur are seen to be 5 to 20 years. And there is enlargement is uniform and soft. This goiter may develop physiologically at time of puberty and in pregnancy when metabolic demands are high, and goiter may be subside by itself or by iodine therapy. And diagnostic features include exophthalmos, thyroid gland enlargement, loss of weight in despite of good appetite, tremors, thyroglossal duct cyst, and an asymptomatic midline swelling that displays vertical movement and tongue protrusion on swelling, commonly seen below hyoid bone, seen before the patient reaches 20 years of age. So pleomorphic adenoma, it is a lobulated painless swelling persistent over many months or years. Tumor is firm but variable consistency. Warthin's tumor mostly occurs in the lower portion of the parotid overlying the angle of mandible, are encapsulated lesions and don't undergo malignant transformation, and much lesser dangerous as compared to the pleomorphic adenoma. The adenoid cystic carcinoma, these are the malignancy involving both the major and minor salivary glands. So these are slow growing and may cause facial paralysis when occurring in the parotid region. And characteristic features include Swiss cheese pattern in the histopathological stains. So here we can see a case of adenoid cystic carcinoma in the hard palate. So Sjogren syndrome. So it is a chronic autoimmune disease in which lymphocytes infiltrate and replace parenchyma of salivary glands, and bilateral swelling of parotid glands is seen. So primary Sjogren's include dry mouth and dry eyes. Secondary Sjogren's include dry eyes, dry mouth, autoimmune disease like rheumatic arthritis. Its diagnosis is seen by Schirmer test, which shows a decreased lacrimal secretion, and significant laboratory changes include identification of SSA and SSB autoantibodies.
Action.
So the clinical pearls we'll be discussing in this presentation, the rule of 80. In a non-thyroid neck mass in an adult, 80% are neoplastic. Of those, 80% are malignant. Of those, 80% are metastatic. Of those, 80% are from the primary sites above the clavicle. Red flags for malignancy. So first we will see the fixity, swelling fixed to underlying structures or skin, as you briefly noted under fixity. Nerve palsy, for example, facial nerve paralysis in a parotid lump, almost always indicates malignancy. Rapid growth and pain, while inflammatory swellings are painful, a hard, painful, rapidly growing mass can be a high grade malignancy. The 4 Ds of danger, especially in the neck or the floor of the mouth. So, dysphagia, difficulty in swallowing; dysphonia, voice change or hoarseness; dyspnea, difficulty breathing; drooling. Let's discuss the mealtime history. History. A 45-year-old patient complains of recurrent swelling below the jaw on the right side. They notice it gets large and painful, specifically just before and during the meals. And the clue, the smell of the food stimulates saliva. So diagnosis, it can be sialolithiasis, salivary stone. In the submandibular duct, the stone blocks the flow of saliva, causing back pressure swelling. The moving midline mass, as discussed earlier, as we saw that child, the 15-year-old child patient with a painless smooth swelling in the midline of the neck just below the hyoid bone. So examination, the swelling moves up when the patient swallows. Crucially, it also moves up with the patient protrudes their tongue, the thyroglossal duct cyst. This distinguishes it from a thyroid swelling, which moves with a swelling but not tongue protrusion. The Woody emergency. So, history: a patient had a lower molar extraction. Three. So I'm not able to see the question. Now presents with a massive firm board-like swelling, the floor of mouth, fever, and difficulty breathing. So it feels hard like wood and is bilateral. So the diagnosis, so 3 days ago, diagnosis Ludwig's angina, and this is and this is bilateral, and it is a life-threatening cellulitis that requires immediate airway management. Cold abscess. So the cold abscess, how do you manage a cold abscess, the tuberculous abscess in the neck? Why not simply incise and drain? So the contraindications, routine incision and drainage is contraindicated because it leads to a chronic non-healing sinus or fistula. So the management is to start the anti-tubercular therapy, the wide bore needle aspiration through a zigzag tract, not dependent area, to prevent sinus formation. If surgery is needed, the entire abscess wall or gland must be excised after bearing weeks of ATT cover. Thank you.